We'd heard repeal and replace for so long. We'd seen the White House try in its own way to work with Congress on some sort of legislative change to this particular law. What caused this about face, and how much more can this administration do incrementally when it comes to the Affordable Care Act?
They can do a lot of damage to the Affordable Care Act just with executive authority. What they cannot do is replace the Affordable Care Act. So what we might wind up with here is effectively repeal with no replacement and real disruption to U.S. insurance markets.
And of course, we are seeing already that impact at the chart 9598 showing you healthcare stocks already falling after not only the executive order last night, but also these subsidies being cut. We are seeing, of course, the biggest risks, hospitals taking a hit. Max, how big of an impact will this be to an already fragile healthcare market?
It could be a very big impact, potentially. I mean, there are actions even separate from the executive order and not continuing to pay the subsidies. They're going to have an impact as well. For example, cutting funds to advertise the exchanges and cutting funding for so-called navigator groups, which help people actually sign up. So all of this is going to have kind of a combined effect to depress enrollment, increase premiums, and you know, if the executive order is kind of put into place to its fullest possible extent, that could divide the market even further and send premiums soaring more.
Max Nisen, this was done in part with great flair. There was a ceremony at the White House yesterday. We saw the president sign this executive order. The second component of this happened last night via a statement. But it's happening immediately. There's no transition period here. How does that complicate this process? How does that complicate things for insurers who have to deal with this quick turnaround?
They couldn't have picked a much more complicated time to do it. So this comes after they already committed to enter certain markets here, after they set their premiums for the most part. So there's relatively little they can do to react to protect themselves. Although there is the potential that some insurers will still pull out. That was sort of an option for them in some of these contracts. So since there was so little lead time, so little notice, it makes things messier anyway from what would have been messy no matter what.